Yeah, I believe that filler market will not disappear.
Again, the product speaks by itself.
Imagine how competitive the market is there.
For under eye area, I really stay clear of hyaluronic acid.
To a level where I actually use it on my skin.
Hi, welcome back. We're still with a panel of experts, doctors. So we shall continue with our question for today. How do you incorporate Juvelook into multimodal treatment plans for comprehensive skin rejuvenation?
Yes, I almost always use multimodal treatment when using Juvelook. But the choice of modality of treatment to combine with Juvelook depends on the purpose of treatment or the skin type of the patient. For example, if the treatment is targeting skin pores or scars, then a fractional laser or needle RF are required with Juvelook treatment. Or when we target the skin brightening, then Q-switch Nd:YAG laser will be more appropriate to combine. But we need to consider about skin sensitivity of our patients. So if the patient has a very sensitive skin, then we need to avoid irritating devices. And I would recommend softer method to deliver Juvelook.
Mm-hmm. Maybe as patient, I can ask doctor, any of the doctors can answer. How do you decide which type of method should be used? Like example, my experience as a patient, at the first time I tried Juvelook was through the injection. And then after that, it was through a machine with smaller needles. Maybe Dr. Nas can explain on how do you decide on which method is the most suitable for patients?
And again, as mentioned by Dr. Choi, it actually depends on how we see our patients in overall. For example, when we are examining the skin, if you see the patient has a very dry skin at the same time, and also they have scars, you cannot start with something that is too harsh for them. So for me, I will go with the laser or devices. I will hydrate the patient first, make it the skin very healthy enough to go for any invasive scar treatments. That is how I choose my patients. And secondly, I look on their daily activities as well. For example, if our client meets with people every day, they cannot afford a longer downtime for, especially for scar treatment. We choose something that is less and minimally invasive, but yet give almost the similar results as multi-modalities. Yeah, we go step by step. I never put patient on too many treatments in one session. So for me, maximum of 2 or 3 will be enough, rather than we go for too many treatments in one session and your patient cannot cope it. So it actually depends on depending on
maybe Dr. Stephanie or Dr. Emma wanted to add on the multimodal treatment plans.
Yeah, I agree with all the doctors. You can use Juvelook as a standalone treatment, or you can combine it with other modalities, such as energy-based devices, light and lasers, other injectables, and even for my self-surgery. I mean, I really like Juvelook combined with other injectables such as amino acid replacement therapy or polynucleotides. I think I always believe 1 + 1 is more than 2. And now more and more, post-blepharoplasty, I'm also, improving their skin texture, which I can't do with surgery, with Juvelook injections, and also building up volume with Juvelook volume.
Yeah, I agree with all three. I believe that as doctors, we are trained to not only look at the surface of the skin, but also to identify the underlying pathology and the problems, right? And then we are sort of the chef with a lot of ingredients in our cupboard. And what do we choose to add flavor to the soup, right? So what do we choose to actually use to correct the particular pathology, and which layer do we put the ingredient in? So if you have a very deep, like what Dr. Nas said, the acne scar, which is very deep, then you might want to place the ingredient, or in this context, perhaps Juveluc into the deeper layer to give volumizing and biostimulation to the deeper layer. But if someone comes with fine lines, open pores, and skin quality a little bit in a poor side, then we want to place the product superficially, right? So as a doctors, this is our job, right? So we identify the pathology and we administer the product based on our assessment.
Mm-hmm. So I think this next question will be relatable to the first question as well. How can the results of Juveluc be maximized in a clinical setting? How do you achieve maximum results in a clinical setting?
I think it's very related. Juveluc can be done standalone, as well as it's so versatile that it can be added into a treatment protocol or regime with other injectables or energy-based devices, such as lasers, such as microneedling with radiofrequency. It can be added with, it can be done together with botulinum toxin, your filler injections, and also really depends on the doctor assessment.
But is it wrong for me to say that Juveluc is actually very flexible? Is that the right way to use that term?
Actually, I would say Juveluc has wide indications. So not only for anti-aging treatments, but also young patients who have bad skin texture, such as acne, atrophic scars from acne, or enlarged skin pores. Juveluc could be used for very wide range of our patients.
Since we have Dr. Choi all the way from South Korea, I want to address this question to Dr. Choi. So we know that South Korea or Seoul itself is the capital city for aesthetic medicine, right? Everybody is referencing to Seoul.
Especially Gangnam.
Especially Gangnam, yes. So for aesthetic medicine practice. And I believe that I can only imagine how competitive the market is there. And there's so many products, in Korea that the Korean doctors can choose. What really makes Juveluc stand out in Korean market out of so many biostimulators?
Yes. I think there are many reasons. I can guess there are many reasons why Juveluc is really outstanding among other so many products. I also use more than 10, maybe 15 products related to skin boosters. But among them, Juveluc is the most commonly used in my clinic, not only in my clinic, but most of all aesthetic clinics in Korea. I think there are some reasons, but the first one is the efficacy of the product. Because in the beginning, when Juveluc was launched in Korea, most of clinicians they had some anxiety. I mean, they worried about the safety and efficacy. But after a long time of experience, and it is proven that it's way effective than other skin booster products. The safety is still safe. So that's why suddenly the users increased in number. And that's why I think Juveluc opened the door of biostimulating particles.
So the patient came back asking for more, and the doctors actually realized the potential.
And one more thing is there are very strong trend in Korea, like global, but especially in Korea, people don't like volumizing anymore. I think we are responsible for that phenomenon because we used to inject a lot of fillers.
Yes.
So this kind of trend is also very affecting the market of Juvelo.
I think nowadays people are looking for a product that doesn't over volumize them or overfill them, but rather give a more healthy skin. Yeah, and stimulates collagen from within.
But filler still has its role in medical aesthetic to a certain extent, right?
I believe that filler market will not disappear, but it's decreasing.
Getting less,
Getting
and
less, yes.
it's decreasing.
And I think Juvelo has also introduced this new term that actually dermo lifts, hydro lifts. So you actually people are finding that you can actually get a lifting effect just from volumizing that skin and increasing the skin thickness. And with that sort of good skin quality, you actually need less filler to get the volume that you need compared to previously if you didn't have good skin quality. So I do believe Juvelo is changing the game of rejuvenation.
It gives you a more natural look and natural approach.
Yeah.
So maybe each one of you would like to share any final thoughts or advice to other doctors regarding Juvelo.
Okay, as part of the scar fighter community, so I myself still looking for something that give a very, very efficient results with a very good efficacy for my scar patients. So with Juvelo, I see there's a light for our patients, and most of them are really, really happy with the results. And the product speaks by itself. So without too much of explanation to our patient, just to a sweet consultation about how the product is on the patient and how it's going to give the effect, patient are already satisfied. So again, the product speaks by itself.
To the doctors out there who is practicing aesthetic medicine, I believe that we should take trend lightly, but we should not give away our capability or our ability to analyze evidence. So choose a product not based on trends and marketing, but based on the strength of the science behind it. So with Juvelo, I've read through a lot of scientific papers and published papers on Juvelo, and it's something that really able to convince me as a doctor that to a level where I actually use it on my skin.
Okay.
Right. So
now it's out there. You're
yes.
using it yourself.
So it's very important, before if you are not convinced on the product to be injected onto your own skin, then it doesn't give you the right as a doctor to be injecting to other doctors, other patients. Yes. So know your science, know the product well, and then choose to use that treatment, not because of trend or marketing.
I would say to all the doctors watching, try it yourself.
Yes.
Try it yourself. Okay,
Exactly. I think all of us would not be here if we didn't have the conviction or were not convinced. I think thanks to Dr. Choi, who admitted that he's been doing it on himself, all of us have been doing Juvelo on our skin. So number one, I think be convinced. And as to what I said to patients, the same thing I'll say to my colleagues as doctors. I think our resources are finite, so is our time. There are so many new products and injectables out there. Technology is constantly improving. So we do want to choose something that is safe and effective. So with Juvelo, we have all the clinical papers. Take your time to read through them. A lot of effort has been made. And I think in terms of effectiveness, we've all been convinced, not just by ourselves, but by our patients' experience. And again, Juvelo is such a wonderful product because it's versatile in terms of prejuvenation for the younger generation, rejuvenation for the older generation, scar treatments and textures. And for surgical practices, it really enhances your surgical outcomes as well. So I think Juvalook is a great product to bring into any aesthetic, oculofacial or plastic surgery practice.
Wow.
So as an oculoplastic surgeon, right? So you are using it for your under eye treatment as well, right?
Yeah, so for some patients, because with surgery alone, we usually can't change that skin texture, but we all know as aesthetic doctors how important the periorbital skin is because it's the thinnest part of the body. So what Juvalook does is it improves the skin thickness and texture, and that really solves many of the problems in the periorbital region. Yeah, so we use it as an adjunct to our surgery. During the surgery, or right after the surgery, we give some Juvalook to improve the skin quality. And if the patient needs more volumization, we can use Juvalook Volume or Lenisna.
And definitely you'll find that it's more, I would say, a little bit more superior than the pure hyaluronic acid. Or
For under eye area, I really stay clear of hyaluronic acid. I will give HA to the tear but not like Juvalook where I'll go right underneath the lid margin. Yeah.
Okay, Dr. Choi, maybe something you want to say?
Yes. Although this product is really fantastic for beginners, they need to follow the guidelines provided from experts in the beginning. And then once you get used to this product, you can use with your own recipe, your own methods. That's why it is very interesting and sexy item for our skin. And like other doctors, I strongly recommend to do by yourself first and do convince about the product, and then can easily recommend to your patients.
You definitely say the right things once you know how does it affect your skin yourself. So I think that's the best part. When I go to a clinic and a doctor say I use it myself and I can feel the result, I would be more convinced. I guess as a patient, that's what I would say. Thank you, doctors. Thank you, Dr. Choi Ho Soong, Dr. Stephanie Yang, Dr. Edmund Lau, and also Dr. Nazilia Tubroni. And again, thank you, Juvalook. Thank you all, everyone that is watching this show today.